So today the question we received a very interesting question, and which is also one of the most frequently asked question at our clinic, and that is like we don't get enough of results after teeth whitening, or why don't I get enough change, or I don't see any change after teeth whitening. And I would like to start off with like different products. Like one of them is teeth whitening in office, or power whitening that we do inside the clinic, and then we have at home whitening, which is typically done at home. So the whitening that's done inside the clinic is very powerful. It's definitely there are shade differences, but it will also depend on the stains upon the tooth surface. So there are two different types of stains. One is deep stains, which is usually from fluoride stains, tetracycline stains, and these stains are there from the childhood onwards. And then there are surface stains, such as coffee, cigarettes, wine, and all this. These stains are much later in life, and then over the period of years, your teeth starts to get. Stains are pretty easy to bleach out. So because they are on the surface, they're kind of easy to bleach out. And we usually get around 4 to 5 shades whiter for our patients. But then the deep stains, such as tetracycline or fluoride stains, are much harder to bleach out. So that's different. Second, now we have patients who have come to us with different levels of shades. Some shades are much darker. Yes, we get around 4 to 5 shades whiter, but they are not white enough to have that wow effect. And this is where most of the people have a concern on. Now, for these patients who have much darker staining on their teeth, will need multiple sessions of teeth whitening to have an difference, to make an impactful difference. So maybe it could be a power whitening, which can be repeated every 6 months, or a combination of power whitening with home whitening. Home whitening is a special kit. If it's done professionally, we make a specialized tray, and we'll give you a carry home gels, which you need to put inside the trays and leave them there about half an hour, 1 hour, or overnight, depending on the type of product, depending on the concentration of the gels, and so many. Only doctors or dentists can actually explain to you like what kind of duration you can use and how it needs to be used. So if you are in a hurry to get a very good, nice white results, you will need a combination. First off is to have your teeth cleaned very well, do the whitening. You'll get 4 to 5 shades whiter. Go home, continue with the home whitening for the next week or 2 weeks, and monitored by the doctor. And the doctor will see if you need to continue with the home whitening till about say 2 to 3 months, and then have another session of power whitening. This way you can accelerate your shades much faster, and you will definitely get very good results. Something that you need to be aware of is sensitivity. Sensitivity is a sharp shooting pain from that's the typical characteristics of a teeth whitening product, but compared to a sensitivity from cavities, sensitivity from infections are completely different. The sensitivity from teeth whitening is temporary. It just lasts for about 1 day, maybe 2, and can be easily controlled with some sort of pain tablets. At home, when you do the teeth whitening, typically after 3 days or 4 days, you may have some sort of sensitivity. Just pause for a day, and then you can continue back on. So this way, like, the sensitivity can be controlled. You can also use a toothpaste that's specifically designed to reduce sensitivity. This can also help. Is teeth whitening on this way harmful? Definitely not. It's one of the safest procedures in the dentistry, but then there are conditions applied. You need to be responsible. You cannot go overboard. Once you get to a shade that you are very comfortable with, what you need to do is just maintain them. Maintenance is done once a week, once in a month, depending on how frequently you consume all the stains. I hope I was able to answer all the questions, even if there is a very short period of time. Next time we'll come a little bit more earlier. And if you have any questions or queries regarding this, please do post, and we'll get back to you on this one. Thank you.